yesterday, along with Senator Boxer, Senator Klobuchar, and 43 other senators, I introduced Senate Resolution 187, a resolution condemning the use of violence against providers of reproductive health care services to women and expressing sympathy for the family, friends, and patients of Dr. George Tiller. Unfortunately, the murder of Dr. Tiller was not an isolated incident. Our country has a history of violence against reproductive health care providers. Since 1993, 8 clinic workers have been murdered, and there have been hundreds of additional attempted murders, bombings, death threats, and kidnappings. Since 1977, there have been more than 5,800 reported acts of violence against providers and clinics. My own state has been touched by such acts of violence. In December 1994, a man from New Hampshire killed 2 workers at clinics in Massachusetts, including a nurse from Salem, New Hampshire. Almost 9 years ago, the Feminist Health Center in Concord, New Hampshire was burned in an arson attack. These acts of violence are just not acceptable. Not only do they violate our laws and lead to human tragedy, but they dissuade medical professionals from entering a field of medicine that is critically important to women across the country. Madam President, I realize that the issue of reproductive choice is divisive. I know that there are many heartfelt feelings on both sides of this issue and on both sides of the aisle, even within my own caucus. However, I was hopeful that regardless of our differences of opinion on this sensitive issue, the Senate could come together and quickly pass a resolution that rejects the use of violence against reproductive health care providers. Sadly, this is not the case. My co-sponsors and I have tried to pass this resolution by unanimous consent. Unfortunately, some on the other side of the aisle have objected. How disappointing that in this country and in this body, we can't come together to unanimously condemn the use of violence. My co-sponsors and I were urged to eliminate references to women's reproductive health care to get this resolution passed through the Senate. Well, we're not going to back down. This country should be able to come together to condemn violence against reproductive health care providers. It is a very sad day when the elected leaders of the greatest democracy on earth can't agree to protect those exercising their constitutional rights. I'm pleased to be joined by 45 of my colleagues on this important resolution. We're saddened that we're not able to pass it without objection. Madam President, I'd like to now read this simple resolution, a resolution condemning the use of violence against providers of health care services to women. Whereas Dr. George Tiller of Wichita, Kansas, was shot to death at church on Sunday, May 31st, whereas there is a history of violence against providers of reproductive health care, as health care employees have suffered threats, hostility, and attacks in order to provide crucial services to patients. Whereas the threat or use of force or physical obstruction has been used to injure, intimidate, or interfere with individuals seeking to obtain or provide health care services. And whereas acts of violence are never an acceptable means of expression and always shall be condemned. Now, therefore, be it resolved that the Senate expresses great sympathy for the family, friends, and patients of Dr. George Tiller, recognizes that acts of violence should never be used to prevent women from receiving reproductive health care, and condemns the use of violence as a means of resolving differences of opinion. Madam President, I find it hard to believe that this language condemning the murder of a health care provider and expressing sympathy to a family in mourning could be objectionable.